Namaskar. I'm Ashok Vyas. Welcome to Innovation about the community on ITV Gold. Happy Thanksgiving to you and stay safe this weekend. If you go for shopping, maintaining the sense of gratefulness, it is important that we are grateful that we are safe and healthy. And in order to take care of our as well as others' health, wearing mask is a must. With that out, let us move towards today's highlights. We will have state representative re-elected in Georgia, Angelika, talking to Aditi Lamba in today's ITV Gold. In This Week with Padma Shri Dr. Sudhir Parikh, we look at American situation in terms of politics as well as COVID-19. We will also have a report on a Lifeline for religious persecuted, that is part of the panel by Coalition of Hindus of North America. Dr. Tushar Patel talks to us about significance of wearing masks in the face of COVID-19, and sadly we have lost an important member of our community leader, Dr. Ajay Lodha. We will be remembering him as we conclude today's Vision of Asia. All this coming up for you right after these short messages. Stay with us. You're watching Vision of Asia for the community on ITV Gold. While we are celebrating Thanksgiving, and in the spirit of thanking, here is the chance for re-elected state representatives in Georgia. And Angelika talked to Aditi Lamba for us. Here is a part of that conversation.
I have to say congratulations. You have been re-elected to the position of a state representative for 50th district of Johns Creek. So again, congratulations to you. I would love to ask you, how are you feeling upon this election?
Well, right now I have to say I'm very relieved that this long election cycle is over. Yes. So we had some time to take a little break afterwards. So I'm feeling pretty good right now. But as you know, here in Georgia, it stays interesting with the upcoming Senate races in the runoffs. So we're still very aged here.
Yes, for sure. And I would love to get your insight into the Georgia race very soon. But right before that, let's discuss a little bit about your campaign representative. You went against a Republican for this position, and you were the incumbent for your position. How was that entire campaign run for you and your team? And what was important for you to focus on during this time when we also had the pandemic going on?
Yeah, this is a really great question. So one of the things I want to point out is that my opponent was a Republican and an Asian American. So we had two immigrants in the race, which makes the race very interesting and really highlighted the importance of the immigrant community in this district and in the greater Atlanta area and in Georgia. The pandemic really changed how we could campaign. We mainly ran our campaign virtually. So invested a lot of into social media. That was different to what we did before, because we were kind of like missing the personal contact because we couldn't go door to door this time. So we had to kind of like revamp our whole campaign strategy to really rethinking how can we reach voters in a safe way, because we made it like we really wanted to emphasize that we wanted to run a safe campaign where we don't expose neither our volunteers nor the voters to any risks. So that was very different.
Yes, for sure. You know, in terms of just talking about your elections, when you were running a representative, what issues, according to you, mattered the most for your district? I know your district is super diverse. It has a lot of South Asian Americans as well. So what mattered to those residents of your district?
Well, what mattered to them most was really driven by the pandemic. It was really healthcare. Healthcare was the number one issue in our district. And we ran on a strong healthcare platform, really emphasizing that we want to bring affordable healthcare to every Georgian. And I think that resonated with the constituents here in my district and with voters. Also, the next thing is, of course, economic development, because many many people lost their jobs. Businesses are struggling due to the pandemic. So all these issues, basically what the whole nation cares about right now, really is like you see it in a microcosmos in my district.
Definitely. Representative Kausche, what are the current needs of your district when you're looking at the COVID-19 ramification? I'm talking specifically about the healthcare system crisis as well as the economic depression that we're seeing. What are the needs of your particular district 50th?
Well, and it's very hard to say what the needs particularly are. I mean, my district is still comparatively doing well compared to other districts because of the economic structure of my district. So most people here, a lot of people here, have access to affordable health care. However, I'm seeing a greater, I'm seeing an uptick in the demand for help, for needs. I'm getting more and more calls from people who still have not accessed their unemployment insurance in Georgia. That is definitely a risk. We're coming to the end of the year where the eviction moratorium that was issued by the CDC will expire. So the upcoming so the new year really causes a lot of anxiety for a lot of people, and many people, even in my district, are struggling and don't know whether they can stay in their apartments, whether they will lose their homes. So it's really the whole spectrum of anxiety that we see in the whole country is really, you see it in my district as well. And I have to say the rising COVID numbers right now are very, very concerning. And while we're still not doing as bad as other in the nation right now, it is a very, very big concern here.
Where are we in terms of COVID-19 and what is it that we need to do is an important issue, as well as how smooth the transition is or what is happening with respect to President-elect Joe Biden, and what are the plans of President Trump's team. There are lawsuits pending and all these issues. We talked to Padma Shri Dr. Sudhir Parikh. Here is special edition of This Week. Namaskar, I'm Ashok Vyas, and today is a very special edition of This Week with Padma Shri Dr. Sudhir Parikh. There are many, many important aspects related to our lives that we'll be discussing today. Let me have the pleasure of welcoming you, Dr. Namaste. Swagat hai.
Namaskar, namaskar.
So we go from some local and things that are very close to our hearts, and then we go towards the international issues also. But I want to begin by paying our tributes to commonly loved person, your close friend and former president of API as well as Rana, Dr. Ajay Lodha. Thinking about your memories of having spent time and having worked with him, what comes to your mind?
Well, he was a great, very close friend of mine, was a great human being, a great physician and very caring physician. And great community leader. And actually, before he became sick with the COVID, a couple of weeks before that, we all traveled together to Mar-a-Lago, Florida, to meet President Donald Trump. So we spent 2 days together there, and we had a really very fond memory of spending time in Mar-a-Lago. And meeting the President Donald Trump. And after that, when we came back 2 weeks after that, he became kind of infected with the COVID. And from there, he went downhill. But he was very great fighter. He fought the COVID illness so vigorously. We did their family did everything, whatever possible, including lung transplant, but we lost him at the end, and really we miss him. Our prayers are with him and his family. God bless him, and really it was lost to me personally, loss to our community, RP community, physician community, and it lost to everyone, those who knew him or those who knew about him. So really, God bless him and go and keep. Rest in the peace, and that's what we pray to the God.
So that is absolutely true, Dr. Saab. When someone who has worked closely and has served with passion leaves, it is very difficult for people around to sort of bear that loss. And we switch our focus towards COVID. COVID's third surge is declared, and we have to be again extra cautious. So, but in the meantime, we have heard about vaccine, etc. So, how do you feel about overall situation of COVID, and how much concern a common citizen should be?
Well, currently it is very, very bad situation. The infection rate is very high. And this week, holidays are coming, and in spite of warning to people, still yesterday there were 2 million people were on airport, and that is not good sign, because that will end up getting more spike next week, and that is a bad news. So again, everyone has to kind of follow the instruction, follow the guidelines to prevent or minimize the surge of the new infection. Number two, but there is a light at the end of the tunnel. That 3 big vaccine, successful vaccine from the big pharma, Moderna, Pfizer, and AstraZeneca, has been data are out, and they say all those 3 are very effective vaccine to prevent COVID infection. So we are very hopeful, and I think out of 3, 2 will be available probably in the market in the 3rd week of December. So only 3 weeks away. So my urge, or my kind of request to all of everyone to next 3 weeks be more extra careful, wear the mask, keep the distance, and don't get together, not even with the family member, those who are not living with you for last 15 days, because these are the small gathering at home or private gathering right now. They are the super spreader. So be careful. 3 weeks are not too far. Once vaccine is here, then you should inoculate yourself. Get inoculated with the vaccine, and that will curtail. And by next spring, hopefully, pandemic will be under complete control.
Hopefully, the pandemic would be under complete control. These words sound very, very good. But now, if we try to understand why this again surge, where do you see lies the reason so that we should avoid it? Do you think it is related to something which has happened in the recent past in America, be it the election rallies or people gathering to converse or to go for voting, or what might have triggered?
No, I don't think it's from the election rally. That could be one of the factors, but more than that, people are still, going out, socializing in the evening, going to the bar and restaurants, and plus they get together with the friends, because they think that when you get together with the known people, usually you don't get COVID, but that's not true, because there are so many people who carries the infection without any symptoms, so there is no way to know who has infection. And when we meet our friends, close friends and close relatives, we do not follow the guidelines. We don't wear the mask. We eat together. We don't keep the distance. And I think these are the super spreader right now. and we have to be very careful about it.
So we should not put our guards down, and being careful is, as they say, prevention is better than cure. And once you start slipping, then it leads to very fatal state that we just talked about. Now, we have seen election results came, and there are lawsuits in the process. But yesterday, for the first time, it seems that formal transition has kicked in. Uh, the legal team of President Trump failed to convince some courts. Probably they won some cases. But how do you see where we are politically right now in America?
Well, politically, I think both the candidate has right to exhaust their legal avenues or legal whatever legal rights they have to figure it out whether everything went well and everything went legitimate and so forth. And that's what President Trump is doing it. But since President Trump has, it was good news that he agreed to let it transition starts officially. That is a good sign, and then that shows that hopefully all the transition will happen very peacefully, and no one should worry about any uneventful or unpleasant episodes to play.
And I would read out the tweet by President-elect Joe Biden. And again, there are some people who say that till President Trump has not conceded, it's probably technically not correct to call him President-elect. But then again, leaving that part aside, his tweet is, the election is over. It is time to put aside the partisanship and the rhetoric designed to demonize one another. We have to come together. And I think the need to unify always exists. But considering the way the country is polarized, how easy or difficult it is likely to be for President Biden, your take on that?
I think it all depends upon how this legal challenges pans out. If legal challenges pans out and if there is no evidence or there is nothing there, then eventually there will be unity, and both the side will slowly come together, and we hope for that. But otherwise, there is always first few months of a couple of years because polarization is so much. So and idea of philosophy or ideas of ideology are so different, so it's bound to happen little disagreement, but eventually time will heal and it will work out.
And talking about unifying and different interest groups that work in politics, I share a part of the Indian American Muslim Council's press release, where they, while compliment President-elect Joe Biden for having picked Anthony Blinken's as a nomination for U.S. Secretary of State, they conclude by saying that they look forward to President-elect Joe Biden and U.S. Secretary of State nominee to implement the recommendations of the U.S. Commission for International Religious Freedom by putting India on the State Department's list of countries of particular concern, CPC, a designation that USCIRF made over a year ago. Now, these are some of the issues which were discussed even before the election. And so there are going to be opposing forces to these ideas, as well as some other ideas. The ability of the new leader to reconcile with various forces is always a challenge. Do you see that potential in President-elect Biden to meet this challenge?
So I think probably Biden President Biden administration will be challenge for India, because the president and vice president, not mainly president, but vice president Kamala Harris, she is known for her liberal and leftist views, and that may create herself or her supporters or administrative appointees may create a problem for India. It will not be a smooth sail as it used to be in last administration.
I think very, very profound words. And as we move towards the concluding part of our conversation, former President Barack Obama's book also talks about India at length, brings about reference about Rahul Gandhi and Prime Minister Manmohan Singh. But overall, the way you have seen Prime Minister Narendra Modi having worked closely with President Obama as well as with President Trump, moving forward, how do you see India's likely approach and potential relationship with America under new administration?
Well, India, I'm sure Prime Minister Modi will do his best to keep the very good relations with the U.S. administration. But I can see that knowing Vice President, President, and their advisors, there will be a challenge. There will be challenges, and there will be little disagreement between what government of India thinks about any subject, including minorities and including China, including other things, and what this incoming administration thinks about it. There might be some challenges, but I'm sure always in diplomats, they know how to smooth out everything and work in favor of both the countries. So it will be fine.
And lastly, as you have been very active with the Indian caucus, do you see any additional proactive role that Indian American community should play in the light of the changing circumstances?
I think so, because Indian American community should try to recruit more congressmen into the India caucus, or more senators into the Friends of India caucus, because by doing that, always any conflict between or any disagreement between USA and India is easy to smooth out, and we can gain a lot of foreign direct investment to the India, as well as strategic defense strategy can work better if Indian American becomes more proactive and educate our congressmen and senators. That's always a good idea, and that's the only way to make both the countries to work together in their interest.
Thank you very much, Dr. And your parting words for our viewers from today's show.
Well, I mean, parting word again, I would stick to the COVID, because COVID right now is very, very high. There is a definitely third wave here. A lot of almost 20%, 10 to 15% of the people are infected. And during holidays, if people do not observe the CDC guideline, they may end up having more COVID infection next week or week after. So be careful, follow the guidelines, and and be safe. It's only a question of 3 to 4 weeks, and you will have vaccine, and that will help to end this horrible pandemic. So please careful, stay safe, and stay healthy. Goodbye. We'll see you next week. God bless America. God bless India.
CAA was represented with a lot of misinformation by media, as well as some people with vested interests. What CAA is, someone who is founder of Coalition of Hindus of North America, Nikunj Trivedi, has taken it upon himself to clarify some of the doubts related to CAA. He organized a panel discussion in which Supreme Court attorney from India, Shubhi Khan, also joined. Here we have part of that dialogue on CAA.
What is CAA in your words? What is like the idea behind the CAA?
That's a loaded question. That's a good first question. Okay, so I think, well, if you looked at my video, the CAA is basically the citizenship. It was a CAB before, Citizenship Amendment Bill, and of course it was passed by both houses, so it became the Citizenship Amendment Act, and it is basically to help those that are religiously persecuted in India's religiously persecuted minorities, I should say, in bordering countries. So there's been a lot of confusion about it. It's led to, as you guys know, riots in India. I think a little bit of commotion in the US as well. That's become pretty significant. But there's been a lot of confusion about it because people have linked it with things like the Assam Accord that have happened in the past. Things like the NRC, NPC came in at the same time. So I think there was massive, massive confusion about it. And of course, there was a narrative that kind of carried the wrong story. And when I say wrong, misrepresented and unobjectable facts.
So what are your thoughts? People have spun this as an anti-Muslim, anti-Dalit law, and which kind of boggles my mind. So perhaps you can share your thoughts on it.
Thank you so much, Nikunji. The video which I just saw, I think that is so relevant in today's time. And, I literally had tears in my eyes because you cannot imagine the plight of those people. It is easy for us to, arrange these conferences. It is easy for us, for me to, stand or sit on a dais or deliver a speech on the subject. But, the pain these people go through, it is very important for everybody to understand, from each and every country of the world. So there are questions like, what is CAA? I can understand that is a technical question because many confusions have been created. Some people are misunderstood about it, and some people are maliciously and deliberately creating confusions. But I would definitely come to the legal aspects of it. But just give me a few moments because I would like to cover the entire concept behind it. When I hear questions like, what is the need of CAA? When I hear questions like, is it anti-Muslim? Or what about human rights? Is it human right violations of Muslims? These questions amaze me, Nikunji. And I'm sure you would agree with me because as an Indian Muslim, I live with so much dignity and with so much pride in my country. And I would tell you why these questions amaze me. See, everybody, like all of us know that the partition of country, our country partition of Bharat happened on the basis of religion. Why it happened and how it happened is a different theory altogether. That concept of Ghazwa-e-Hind and making India Islamic State, that is a different subject altogether. But after the partition, minorities from both the countries were still migrating. Minorities from India were migrating to Pakistan and minorities from Pakistan were migrating to India. So to protect their rights, there was a Nehru-Liaquat Pact. And Nehru ji was the Prime Minister of India at that time, and Liaquat ji was the leader of Pakistan. So there was a Nehru-Liaquat Pact which said that, okay, both the countries will make certain protective laws for the minorities. And in case, because India was a secular state and Pakistan was an Islamic state. So it was decided that if Pakistan would fail, if an Islamic state would fail to protect the rights of those minorities, India would pitch in and India would always welcome those people with open arms. So this is nothing which has to do with the present government. This subject has been, cropped up since ages. Like we have been seeing that minorities were persecuted. So there are reasons why I would like to tell you that it is nothing against Muslims can ever happen in India. Like India is a secular state, one. Then part 3 of our constitution speaks about fundamental rights, Article 12 to Article 35. And specifically Article 25 to 30 are specifically for minorities, religious, cultural and linguistic. Since partition till today, at the time of partition, Muslims were 3 crores in India. Right now, they are 30 crores. So there is not even a question of persecution of or any human right violation of, even legal right violation of Muslims in India. There are lakhs and lakhs of mosques and madrasas in India. And all those madrasas and mosques, they are not even under the government administrative control. However, most of the temples are under the government control. And there are Muslim institutions who receive donations even internationally, and even the donations are not taxable. There are so many facilities, aid, support, policies that too government sponsored, which Muslims get in India. Then there's a specific minority ministry in India. And despite being secular, all the Muslim personal laws are still running, parallel judiciary, parallel education system, everything is going on in India. And all the premier positions like president, vice president, chief justice of India, home minister, education minister, etc., have been proudly held by Muslims in India. On the contrary, let me give you a quick picture of Pakistan, Bangladesh, and Afghanistan. All three countries are Islamic state. They have Sharia law. Hindus' customs, practices, marriages, etc., are invalid constitutionally. Imagine. Your existence is invalid in their country constitutionally. So there is nobody to even listen to their plight. In Pakistan, from 22%, I think approx 2% Hindus are left. In Bangladesh, from 23% to 7%. In Afghanistan, forget about percentage. You can count them in numbers. So where are those Hindus? They are either killed or all of them have been converted. And this has been confirmed by United Nations Human Rights Commission report. This is not just my opinion. This has been confirmed. And how many temples have been broken in these countries, and how many NGOs, institutions, or foreign funding these people are getting to protect their rights. Nobody is there to even listen to them. So whose human rights are being violated where? Muslim kids are separated from the entire world. So there are separatist organizations, then there are extremist organizations. And once a child becomes a separatist, then it is easy to make him an extremist. Once he is made an extremist, then it is very easy to make him a terrorist. Like Al-Qaeda or Hizbul Mujahideen or ISIS or Jaish-e-Mohammed, they cannot approach me and, they cannot make Subui Khan a terrorist. They have to, let you go through a process of separatism, extremism, and terrorism. Only then they can use you as a pawn to achieve their goal of Islamic State. And this process also needs funding. So there are institutions like PFI. So if we understand this narrative, it would not be rocket science to understand that no one is against Muslims. Subui Khan is celebrated in India. At times, I become so emotional at the kind of love and support and faith I get from people. So, a Muslim is never criticized or looked at with doubt in India. Has never been the case in India.
Welcome back. You're watching Vision of Asia, Voice of Community on ITV Gold. This program comes to you every Monday, Tuesday, Wednesday, and Thursdays at 8 p.m. and on Sunday at 11 a.m. We always bring you our special weekly edition of Vision of Asia, Voice of Community. Thank you very much for being a part of this show, supporting us. Your support, your presence, and your encouragement is very, very important for us. So thanks especially once again, and stay with us. We'll be right back after these short messages. Stay with us. How New York and New Jersey are coping up with the fresh threat or challenge of the new surge in cases of COVID-19. Dr. Tushar Patel talked to us about the significance of wearing masks to stay safe. It can not be repeated often because many times we lose our guards, we fail to maintain social distance, and that results into further rise in these cases. How it happens, listening to Dr. Tushar would make us even more clear and alert in terms of doing our part in saving ourselves as well as others from COVID impact.
While we are talking about social distancing, I would love to know your comments on indoor dining or indoor activities. At this point, should these activities be stopped, such as the gyms or the restaurants and other things?
I think because that will be the best approach right now. Gyms and indoor restaurants, whatever we can do right now to mitigate or slow the spread, I think that will help. The lessons learned from previous months, especially in our area, if we do that, I think we will see better results in January and February.
Are there any therapeutics that are in the works right now?
So as you know, remdesivir was approved, and now another one is approved, is called Regeneron. So we have two therapeutics right now approved by FDA to use for COVID-19 patients in the hospital. Regeneron is just one dose IV medication one day, which is very effective. That is what President Trump received when he was in the hospital. So I think we do have some therapeutics available right now, but it doesn't work on everyone. So it's case by case. So we have to be still very careful of using the common sense.
Let me ask you something. Do you think COVID is still a mystery to most doctors? Is it still a disease that we still have no idea how it's mutating in the body?
You are absolutely right. This is like a 9 months old baby, right? So you don't know how the baby will behave when he or she become child and adult. So it's the same thing. We need to have more studies, and the studies at least takes 1 to 2 years in order for the epidemiologists to come up with some kind of logic and some kind of science behind it. Why this is happening? Why is this happening to certain population? Why the medication is working on some? Why some people has to go on ventilation? All those things are still premature. We do have a lot of information now than before, but still there are a lot of mysterious questions for the medical professionals as well as CDC and other healthcare agencies.
Let's talk about vaccine, because obviously that's the million-dollar question that everybody's asking right now. How are you looking at Pfizer, Moderna, as well as AstraZeneca? I know they're releasing their efficacy in the vaccine. Could you give us an insight into what's happening in that domain?
So this is the forecast I'm expecting. By end of December, high-risk people, the medical professionals, the elderlies, will start getting the vaccination by end of December. By end of April, early May, low-risk general population will start getting the vaccination. By end of May, early June, the goal of this country to have 70% of the US population receive the vaccination. That will give us the herd immunity, and then we will not have to wear the mask or going in public places with fear.
You know, today the Health and Human Services said that they could possibly start the distribution of vaccines soon after December 10th. Do you see that as a possibility? I know you just mentioned it will start in December, but that's very soon. That's in a week and a half.
Absolutely. And let me tell you one thing about that timeline. So December 10th, Pfizer vaccination or Pfizer proposal will be reviewed by FDA. December 7th, Moderna vaccination will be reviewed by FDA. Within 24 to 48 hours, FDA will rule out, okay, go ahead and approve this vaccination. Once the vaccination is approved by FDA, CDC will weigh in and develop a guidance for the vaccination. So that is how I'm looking the guidelines for the vaccination. And one more thing I would like to mention here. There are 4 different pharmaceutical industries working on the vaccination. 3 of them we already know. Right. Pfizer, BioNTech, which is 95% effective. The drawback of that vaccination, it requires minus 94 degree storage. Right. The cost is about $20. Moderna requires minus 4 degree storage. Cost is about $15 to $25. Wow. AstraZeneca is the one I think we should all look into, which has low efficacy right now, 70% in the initial trial, but the storage is only 36 to 46 degree Fahrenheit, which is in our regular fridge, right. And very cheap, is $2.50. And the one coming up in upcoming weeks or months is J&J, which only requires 1 dose. Wow. So I think, yeah, so it's a light at the end of the tunnel, but I think until we reach that, or until we have the population get the vaccine, we still need to take all those precautions we have been taking for last 9 months.
Right. You know, in terms of the vaccine, Dr. Patel, could you give us an insight into what the vaccine is actually doing from these trials that are happening? What are they doing to the body? So that when you get a vaccination, antigen is given to develop the antibody. So most of the vaccines are based on that. There are traditional ways and newer methods are used this time. And I think this vaccination is 21st century vaccination compared to the other ones.
And that's why we're seeing the 95% effectiveness or 90% effectiveness or 70% effectiveness. In the old days, we only used to get 40, 50, 60% effectiveness. So I think this is what will happen when you get the vaccine. You may get little sick for a day or two,
Right.
have some tenderness, but that is common in any kind of vaccination. And I think people should not be discouraged by those symptoms.
Just a follow-up question on that, Dr. Patel. What have you felt about the number of participants these vaccine trials have had? I know certain only have about 30,000, some have about 10,000. Is it enough sampling of the population to really make an efficient vaccine?
So phase 3 clinical trial requires minimum number is 30,000, and that was achieved in all US pharmaceutical trials. So I think that is sufficient enough in these days and time of 21st century with all the technology available right now to develop the vaccine.
Okay. In terms of the vaccine, how important do you think it is right now for people to take the flu vaccine?
So first thing, right now flu vaccine is available for anyone to take. So everyone is encouraged to take the flu vaccine this year. When the vaccine comes in January, February, and March for the common people, I think we should definitely make the priority and take that vaccination either at your doctor's office or CVS or any other pharmacy, wherever you can get this vaccination. I'm not even sure how the vaccination will be distributed. Is the insurance company will pay for it?
Right.
Who will pay for it? How much will it cost out of pocket? All those things probably will come up within the next few weeks.
What do you say to people that are already saying, I want to wait for 6, 7, or 8 months before I take the vaccine?
Not a good idea, because the clinical trials has been very successful with very minimal side effect, and I think the US government and FDA and NIH did a wonderful job in getting all those things, make sure the compliance is there, and they will be doing that when they review this on December 8 and 9.
COVID has taken the toll of many important members of our community. Many of us have lost our family members or friends. Last week, we lost an important Indian American community member, community leader, past president of important organization, National API, as well as president of Raisan Association of North America. Someone who was very, very helpful and compassionate and a role model in terms of finding a balance between family life, professional life, as well as community service. Dr. Ajay Lodha was born on 4th May 1963, and we lost him on 21st November 2020. Here, remembering this great son of India who came to America after finishing his medical studies. Facing all the challenges, he made it big in his own way. Here, with prayers and love for Dr. Lodha.
Thank you all for coming. Thank you all online for joining us. I do wish we were all together right now, but because of everything we can, and it's just that much more difficult. There's a lot I can say. What I do want to say it took me a very long time to truly understand how special of a person my dad was. So after my dad got sick, it took me a very long time to really understand how special of a person he was, and really all the lessons he was trying to teach us. There were times when he was a very difficult person to be with, and I think everyone knows that. Everyone has their story of some fight, but everyone also has a story of how he helped you and how he really cared so much about what you wanted. And understanding what that meant took me a very long time. Only this year, after he got sick, and just listening to everyone's story, that's when I started learning. And it was like a trial by fire. And I think this year he gave me the best lesson of all of really how to become a better person. I wish I had understood this earlier. And if I could become just half the person that he was, I think I would have lived a good life. So, Papa, thank you for everything you've done. Thank you for putting up with me. I finally understand all the lessons you were trying to teach me. I'm going to try my best to uphold them and continue your legacy. Thank you very much. All of us will miss you a lot.
Papa sacrificed his life serving the community and his patients. He contracted the virus in March by providing care to the most vulnerable patients. His work as a frontline COVID warrior is a testament to his bravery, his courage, and his altruism. While my dad has a decorated list of accomplishments, I most know him as my superhero, my protector, my mentor, and my best friend. He taught me how to fight and stand up for what I believe in. He taught me how to work hard and prioritize community. He taught me how to go above and beyond to help others. I will miss him every single day more than words can describe. But I'm so proud of the legacy he has left behind, and I'm so honored to be his daughter.
Bhagavad Gita says, "No weapon can cut the soul into pieces, nor can it be burned by fire, nor moistened by water, nor withered by the wind." This is the power of the soul and the personification of my father-in-law, Dr. Ajay Lodha. Rising from Udaipur, he came to the United States with a dream. Like many of us, he strived for a better life for his family. In one of his interviews, he was asked about his dreams. He then replied, "Every life is very important." Papa was a COVID warrior, a real-life superhero. With unlimited confidence, he was absolutely fearless. With a remarkable personality, he always made sure to shine his charismatic figure around us. He accepted challenges and climbed the ladder not only of success but of humanity. He never forgot those who helped him in his journey. He stood by all of them regardless. Papa has many dreams for us, and we will always work hard to continue his legacy. He always gave me indirect compliments. To me, he said, "I'm not handling any decoration for the reception on May 9th. You are," which for me meant that he trusts me so much to handle everything for an event. As soon as he met me, he started asking questions to understand the jewelry business, and I instantly knew his next project was going to be to become a jeweler. And without a doubt, it was his next project. I promise you, Papa, I will always hustle and make sure I get out of my comfort zone to reach the top. I knew my father-in-law for 3 years, and the amount of love, respect, and trust he had in me has only given me confidence to show that one day I can make an impact on thousands of people in the world just like he did. Papa, I will always, always miss you and cherish every single moment we spent together.
Ajay bhai, you have been an amazing mentor and advisor and big brother for many like me. I cannot forget but can only cherish the moments we shared together. Ajay bhai, thank you for giving me your bed and sleeping on the couch whenever we shared rooms together on our travels. Thank you for being the go-to guy for routine mundane things in life. Thank you for spending endless hours trying to advise me to be in the right direction and to serve API better over the years. Thank you for the endless banter to humor me during our daily routine commutes to work. Thank you for passionately standing up for me and believing in me. Thank you for being there and sharing with me the great moments and not so great moments. Thank you for dreaming big for me and being more excited than me when I took over as the president of API, and dreaming big for the Chicago 2020 convention, calling it will be a mega convention. Thank you for texting me from your hospital bed that you are going to fight this deadly disease until the end, like a true Rajasthani warrior. Dear Ajay Bhai, we are forever indebted to you for what you have been to the Indian community, medical fraternity in India and United States.
And now time to say goodbye from today's Vision of Asia Voice of Community. Take care, be safe, wear your mask, maintain social distance, keep washing your hands, and do not get to the place where you are one among many people. So all these precautions are necessary for us to move forward safely. And this being Thanksgiving weekend, we are thankful for whatever support we have, and we have each other to support, maintaining the spirit to do the best that we can in the given circumstances. This is Ashok Vyas, once again thanking you with lots of good wishes. Namaste.